Thanks for joining us tonight from different parts of the world and from different time zones. My name is Hinz Joy. I'm one of the director for Job Seekers. We are a New Zealand owned and operated business recruitment consultancy based in New Zealand. We offer assistance for registered nurses as well as enrolled nurses. So basically internationally qualified nurses to come here into New Zealand. And that we control the whole relocation process. So we do assist with their nursing council registration, and also we offer job placement assistance for both domestic and international candidates. I don't want to go into the details of our business, but you're most welcome to visit our website and social media pages, or please feel free to get in touch with us anytime. This webinar is being hosted by Job Seekers alongside with a faculty from Lonsdale Education Centre, who are a leading CAP course provider in New Zealand. So in this session, we'll be more focusing on, as the title says, CAP course competency assessment program and its delivery in New Zealand, especially at Lonsdale Education Centre. Before we kickstart this meeting, I would like to request everyone to please make sure your mic is mute. Just to avoid any distractions and background noises so we can have a smooth presentation. I'm sure you will be given some time towards the end of this session to ask your questions and concerns. And you're also welcome to type it in the chat box, and we will pick it up from there if you have any questions. Make sure your questions are relevant to this topic. I'm sure people will have questions from other areas of migration or visa processing. We're happy to answer those questions, but please focus on this particular topic for this session so that we can utilize it at its best. For Director Jetson Jose, he's also a practicing nurse, so I would like to introduce him. Jetson, please take it from here.
Hey, welcome all. Welcome to our session on welcome to our information session on CAP course. So my name is Jackson. I'm one of the directors of Job Seekers, and I've been practicing as a registered nurse in New Zealand for the last 11 years. And yeah, we are here to give you more information about around the CAP course and how Lonsdale runs this course. And we have got KIM MCLELLAN, operational manager of Lonsdale, with us. I will hand it over to Kim to start off this meeting. Before that, I would like to request everyone to turn on the cameras if you could, because we really want to make this an interactive session rather than just a presentation. And just enjoy your session. I'll hand it over to Kim. Hi, Kim.
Hi, kia ora everyone. It's lovely to be here and to spend some time talking a little bit about our competence assessment program here at Lonsdale Education Centre. I've got a few videos that I will show you. We'll talk a little bit about how the CAP course works, and then we'll also keep an eye on if there's any questions that are relevant, but we'll try and answer them at the end as well. And yeah, so do please ask questions. I like it to be interactive. I like to talk to you. So and also, like, if you do want to turn your video on, feel free to. I think everyone's hidden away there, but that's okay. It's nice just to put faces to names, and eventually maybe you might come and actually be with us here in New Zealand. And yeah, it's just good to see you. So I'm going to share my screen. Oops. Alrighty. In New Zealand, we always it's sort of a sorry, I'm going to start that again. It's quite common now for us to actually start any presentation or any session with like a karakia, which is like a prayer. It's very common. I was in a recent meeting with Te Whata Ora, which is our public hospital, recently, and it's very much the focus where we're integrating Māori o Te Tiri o Waitangi into our everyday practice. So I'm going to start the session, my session, with a karakia, and then I'll introduce my team.
Nore he kororia ki te atua, he maungarongo ki te whenua, he whakaaro pai ki ngā tāngata katoa. Hangā e te atua he ngā kaha, ki roto, ki tēnā o mātou. Whakatongia tō wairua tapu, hei awhina, hei tohu i a mātou, hei ako hoki i ngā mahi mō tēnei rā. Āmene.
He honore, he kororia, maungarongo ki te whenua. Whakaaro, pai e ki ngā tangata katoa. Ake ake, ake ake, amine. Te atua, te piringa, tōku oranga. He honore, he kororia, maungarongo ki te whenua. Whakaaro, pai e ki ngā tangata katoa. Ake ake, ake ake, amine. Te atua, te piringa, tōku oranga. Ake ake, ake ake, amine. Te atua, te piringa, tōku oranga.
Not sure why there's coloured lines in my videos that all of a sudden turned up. Not sure what that's all about, but anyway. That's weird, isn't it?
I know.
It is weird. I don't know what's going on. Cool. So I'm just going to change my display. It's weird. Anyway, we'll go with it. Just ignore the lines. Someone scribbled on my drawings. I don't know. What changed? It's weird. Anyway, we'll go with it. Ooh.
Kia ora tātou, ko Ruapai Hutumanga, ko Whanganui Te Awa no Whanganui Ahau, ko McClellan tuku whānau, ko Kimberley tuku ingoa. Kia ora koutou, I'm Kim MCLELLAN from Lonsdale Education Centre. At LEC, we genuinely care about each one of our candidates. We respect your experience as nurses and we want to help you be successful. At LEC, we run a success model rather than focusing on failure. All our staff go the extra mile. We are creative thinkers and solution focused while also maintaining a very high professional standard. I would now like to introduce the rest of the team.
Hi, my name's Alana. I've been part of the CAP administration team here for about 9 years. I love watching candidates meet their goals and dreamed of working here in New Zealand as registered nurses. Part of what I do here at Lonsdale is I answer candidate inquiries, I review applications and follow up with candidate information and documentation. I also help book OSCEs.
Hi, my name is Shiho. I'm one of the administrators. We are the first contact of the Lonsdale Education Centre. We are looking forward to see you soon.
Hi, my name is Ned and I am one of the CAP tutors at Lonsdale Education Centre. I completed my Bachelor of Nursing in 2009 and I moved in New Zealand in 2016. Our role as a CAP tutor is to assist and help achieve your dream of becoming a New Zealand registered nurse. We will be guiding you through the process and your transition, ensuring that the standard of care will be delivered in accordance to the New Zealand way of nursing. So be ready and prepared, and again, we are here to help you achieve your dream.
Kia ora, I'm Tanya. I'm one of the tutors here at Lonsdale Education Centre. I may be working with you during your OSCE, I may be working with some of you during your placement, but either way, I look forward to supporting you in your journey through your competency assessment program. Take care, stay safe.
Hi, I'm Lauren. I'm one of the clinical tutors at Lonsdale Education Centre. I look forward to meeting and learning with all of you soon.
Hi, I'm Anne Turnbull. I'm a New Zealand RN and I am a CAP tutor for Lonsdale Education Centre.
Hi, I'm Sarah and I'm one of the CAP tutors for Lonsdale Education Centre. I look forward to meeting you all very soon and guiding and supporting you through our process for you to become a registered qualified nurse within New Zealand.
If you or anyone you know is interested in doing a CAP course, please get hold of us at lec.ac.nz. We look forward to seeing your application.
Just going to stop sharing for 1 second.
Looks like someone has drawn on the whiteboard and that's why that lines are on the screen. Apologies from our side. Maybe it's a mistake from one of the attendees, so it's all good.
I'm just sharing again, but I'll just make sure that the sound is on. Oh. All right. So with our competence assessment program, we during COVID times, we decided to change our CAP to online learning. And someone's camera. So online learning and in New Zealand clinical placement. So that kind of came about because it was very hard for you to get to candidates to get to New Zealand, and also it just gave you more flexibility. So you could do some of the stuff on your own, in your own time, self-directed adult learning, which is very common in New Zealand now. We do a lot of online professional development. And then once you gain your visa and you're ready to arrive in New Zealand, then you complete the second part of your CAP course. And we'll go into a little bit more about part 2 shortly. I'm going to try and show you our website. Okay. So when you when you get access to our when you decide to purchase part 1 of our CAP, you get access to our website, or you've already had an application done. Once you get your offer, you pay for part 1, you then get your login details, and you can go directly into your account. So you would come to our website, you would sign into your account, and then you would go to your trainings. So this is my trainings. I'm just going to log out because I'm in someone else's account. Right, a second. So you just log in here. And part one is called New Zealand Specific Nursing Theory. Now we have an enrolled nurse version and we have a RN version. So some candidates may have a diploma and they might have a letter from Nursing Council that says that they can do a enrolled nurse CAT. It's the same type of, it's exactly the same. Part one, part two, same thing. There's only just a slight few tweaks to the enrolled nurse one due to the scope of practice. So when you log in, obviously I come and go out of this a lot. Don't get too fixated on your score here. I've failed it apparently, but that's because I don't do that. I don't do the exam at the end. You guys do the exam at the end, or the MCQ. So it's really important to really immerse yourself in all the online learning modules. They're here for a reason. They're not here for you just to flick through quickly, do the exam and move on. It's all really relevant information around working in New Zealand, what's expected of you as a registered nurse or enrolled nurse. Things like the Health and Disability Act or Commission, Patient Code of Rights, hugely important in any healthcare sector in New Zealand for you to learn and understand. So you work through all your online modules here. Lots of interactives. There's things here where you can actually click on and you can hear my voice. So if you're struggling with English a little bit, go and listen to all the audio clips. It will help you with listening to me, my slang, my language. Sometimes someone else talks as well on behalf of me. So it's a good way for you to have lots of different learning styles in here. When you get to the end of the modules, you click next and it'll ask you to confirm. You just confirm and move on to the next module. If for some reason you want to go back and review the content, because sometimes it's important to go back, review before you come to New Zealand, you just click the back button and it will take you to the previous ones. Now it's important that you make sure that you go through all the modules and you get the green ticks down the side here. That just shows that you've actually achieved or you've actually looked at all the information in the online modules. So that's just a little overview of the content and the type of stuff that you need to review in part one. Now, it is, there is a bit of content there. If you do it in 24 hours, where you clearly haven't read it, and it's, some candidates do flick through it really quickly. Try not to do that. Please make sure you do review it. As I said before, it's all there for a reason. It's all there to support your learning and the process for you coming to New Zealand. A lot of candidates have trouble sometimes coming to New Zealand because they haven't spent the time taking on board the information that will actually help them while they're in their clinical placement and on-bound employment in New Zealand. So good news is you can do them overseas, at home in your country, Philippines, India, Dubai, wherever you live, you can do them online. Then, and or if you're already a healthcare assistant in New Zealand, you can do them in New Zealand too. At the end, there's 2 small MCQ exams or, tests. They're not really a big exam, just 2 small tests at the end. One is medication calculation and administration, and the other one is a theory-based type question. So I'll ask you some, they're not complicated questions. It's just, you going over a little bit of the theory that you might have read during your online learning, and just some really good questions around basic nursing. Part 2 is when you really come to New Zealand and you really are demonstrating that you are in fact a safe and competent practitioner to work here. So your clinical placement is up to 4 weeks, and that can be anywhere in New Zealand. We work quite closely with job seekers to make sure that your placement is in a proper, in a really good location. And Jedson and his team work very hard in the background with my team to make sure that your placement is of a very high standard and you get really good care and support during that placement. When you're in your placement, there's some things that you have to do during that. Before you start, we ask that you arrive in New Zealand at least 4 days before you start your placement so that you can get over your jet lag, get yourself settled and established where you're going to go. You can work out how long it takes you to get to work. How do you get to work? Do you walk? Do you catch a bus? Do you have to catch a taxi or an Uber? Things like that. So it gives you some time to figure it all out for yourself. Then we normally start your clinical placement on a Monday. Now, sometimes we have public holidays on a Monday, so we've got one this coming Monday. And so all our candidates, apart from a small number, will be starting on Tuesday. And we tell you that before you start, and we provide you with a copy of a roster, what your shift pattern looks like. Sometimes the shifts that we give you are not actually the shifts that you're going to be working during your placement. That's because the clinical placement haven't quite done your shifts yet until the day you arrive, or they have a special roster they want to hand to you when you arrive on your first day in clinical placement. Your tutor from Lonsdale, so we allocate a tutor that works with you. They work generally remotely, so it's virtual like this, Zoom or Microsoft Teams. They'll check in with you once a week, sometimes more if you need it. They will ask you to do specific things during your clinical placement in order to achieve. It's really important that when you do, like on the Friday before your clinical placement, most of my tutors will have emailed you. So you keep checking your emails every day, even check your spam box, because some of my tutors are contractors and so they use Gmail to do their emails. So sometimes it can whip into your spam box. So just always check your junk spam and your inbox, all, prior to your clinical placement, waiting for your tutor to engage in a conversation with you. When you get your roster from us, you also have the contact details of your tutor. So you're more than welcome, and I highly recommend that you engage in a conversation with your tutor as well. Just say, hi, my name is Amberly. I'm going on clinical placement next week and I look forward to working with you. So you be proactive too. You have to gather evidence for your domain document. Now, if you don't know what a domain document is, it is the only document that we send to Nursing Council to say that you are safe and competent to practice. This is where you, with your tutor and your preceptor, you work on providing us examples of how you have worked over the last 4 weeks to meet certain standards that Nursing Council require of you. And it's sort of a really nice way to demonstrate to Nursing Council how amazing you are as a nurse, and your tutor helps you work on that and how to write your examples and things like that. It's really important that these are your own examples and they're not someone else's. So lots of candidates have done CAP courses, lots of candidates write these examples, and lots of candidates share their examples, but some the examples you share are checked by your preceptor and checked by my tutor team, And it's important that they are your own examples. So the tutor will verify some of the examples with your preceptor and say, oh, did Amberly do this during her clinical placement? And it gets a little embarrassing when actually you didn't have a patient who had a cardiac arrest on the ward. And, you know, so it's really important to make sure that they're a true, accurate reflection of your experience in clinical placement. We have another assessment called a Clinical Quality Initiative Assessment. We're in the midst of actually changing that assessment, but in the meantime, this is a best practice assessment where you look at a nursing article and you relate it to a patient you're caring for in your clinical placement. And most of our candidates do like a mini presentation at handover to the team and talk about what they found out about the article and what recommendations that they can do to provide better quality care for their patient. We have a virtual or face-to-face OSCE. It's a clinical simulation scenario, and I'll go into more detail about that soon. Generally, it's virtual. It's like this. It's a virtual meeting because candidates are all across New Zealand, and it's hard for us to get you in-house to our testing centre. As much as we'd love to see you all in our testing centre, it just is a lot easier to do a virtual OSCE. Once you've done all that, you get your nursing registration, which is fantastic, and you can start working as a nurse here in New Zealand. At the moment, so at Lonsdale Education Centre, we pride ourselves on getting your document to Nursing Council the Monday following your placement. So if you finish on the Friday, Saturday or Sunday of that last week, your documents are submitted to Council on the Monday. Once it leaves us, the time it takes for Nursing Council to issue that annual practicing certificate is up to them. And at the moment, there's a little bit of time delay. So it used to take about 5 working days. It's gone to 10 working days. And I've heard recently it's about 15 working days. However, at least the document is submitted as soon as you finish your CAP, and you know, you've just got to wait a couple of weeks before Nursing Council issues you your registration. What is an OSCE? We get asked this a lot. I think OSCE is getting out there a lot more across the world because the UK do OSCEs, Australia does OSCEs, New Zealand will at some stage change to doing a very similar model. We like OSCE at LEC because it's another way for us to check that you're safe and competent to practice and how you work through your nursing process. How do you critically think? How do you plan? How do you manage patient complications? Can you escalate your concerns to a doctor or an ambulance at the appropriate time? And it's done like a role play. It's you and your tutor. Sometimes there might be another tutor there supporting the tutor that's doing the assessment. Sometimes we have new tutors learning how to do OSCEs. And sometimes if there's a little bit of concern around your practice, there might be someone like myself there or one of my senior tutors there just to check how things are going. So it's a way that we assess a nurse's clinical skills, decision-making, critical thinking and communication in a safe and controlled way. So it's simulation, it's not with real patients. The first thing to point out to everyone here is that you actually already are a registered nurse or an enrolled nurse, and you've completed a degree or a diploma, and you've got the theory, the knowledge, you know the anatomy and physiology, pharmacology, you have clinical assessment skills behind you. It's just bringing it out and understanding how to do that in a New Zealand context. And so we used to do your OSCE before you came to New Zealand, and we found that a lot of candidates struggled with that because of time zone differences. They weren't really sure what to expect. They weren't really sure how to manage patients in a New Zealand way. So we brought it into your clinical placement. And this is where you really, you've done generally 2 weeks in placement, you know the processes. Our OSCEs will be relevant to your clinical placement. So we're not going to give you, you're in an old person, like aged care facility, we're not going to give you a neonatal intensive care scenario, all right? So don't panic about that. We tailor the OSCEs in relation to perhaps where you're doing your placement and what you might have been experiencing during that placement. It is a 30-minute face-to-face interaction with your assessor. And then once you complete that, you get 1 hour of documentation. So when you get access to part 2 on our website, you'll see the OSCE information on there and the documentation. I've talked for a little bit. I'm going to show you another video. Let's see if we get drawing on this video.
New Zealand is known for its high-quality healthcare system, which is well respected around the world. Nurses who work in New Zealand have the opportunity to provide care that is of the highest standard and to work alongside highly skilled and experienced healthcare professionals. New Zealand is a diverse and multicultural society with a rich cultural heritage that is celebrated and valued. Nurses who work in New Zealand have the opportunity to work with patients from a wide range of cultural backgrounds and to learn about and respect different customs, beliefs and practices. It is a beautiful and welcoming country with stunning natural scenery and a friendly and welcoming culture. Nurses who work in New Zealand have the opportunity to enjoy a high quality of life with access to a range of outdoor activities and cultural experiences. New Zealand is a country that values ongoing learning and development, and nurses who work here have access to a wide range of professional development opportunities. This can include training courses, conferences, and networking events. Nurses who work in New Zealand are part of a supportive and collaborative work environment where teamwork and mutual respect are highly valued. Nurses have the opportunity to work alongside colleagues who are passionate about providing the best possible care to patients and to contribute to a positive and supportive workplace culture.
Nursing in an aged care environment involves providing medical and nursing care to elderly people who require assistance with their healthcare needs. This may include administering medications, managing chronic conditions such as diabetes or heart disease, care planning, monitoring vital signs, providing wound care for acute or chronic wounds, liaising and communicating with external healthcare providers, and providing support and care for those who are needing end-of-life cares. Nurses working in aged care work closely with other healthcare professionals such as doctors, diversional therapists, physiotherapists, occupational therapists, and social workers to provide comprehensive care for their residents. It involves supporting the emotional and social needs of residents. Nurses may work closely with residents and their families to develop care plans that promote social engagement, emotional well-being, and personal interests. Working in aged care can both be challenging and rewarding. Nurses may need to manage complex medical conditions and challenging behavioural issues. However, it can also be an opportunity to build strong relationships with residents and make a positive impact on their quality of life. It requires a combination of medical knowledge, empathy, and strong communication skills to provide comprehensive care and support to elderly residents.
I'll talk a little bit about clinical placements after that. So that's sort of giving you a little bit of a picture around what a hospital in New Zealand looks like in a Te Whatu Ora type environment, and then aged care. A lot of our clinical placements are in aged care. However, we do have some in Te Whatu Ora. However, sometimes they're very hard to get. So, you know, aged care is an amazing place for you to actually grow and develop as a nurse in New Zealand. And even though it might not be somewhere where you actually feel you want to work, or you feel like, but I'm experienced in ICU, I have to have a placement in ICU. It doesn't always, it's not always of benefit for you to go straight into an ICU in New Zealand. If English is sometimes a challenge for you, we have very fast-paced work environments. It can be sometimes not as supportive as maybe you'd hoped it for as you transition into nursing in New Zealand. So aged care offers a lot more of a supportive environment for you. And there's so much growth potential. You can actually move up into different roles, from being a registered nurse on the floor to maybe a senior team leader, maybe the clinical lead. You can then move on to say things like facility managers, roving regional managers, things like that. So there's so much growth potential that can happen very fast in an aged care environment if you're that type of person. Of course, you can just stay as a registered nurse if you're not that, you don't want to move into more management or senior roles, but it definitely has very much growth potential for nurses. It also is a really good starting ground for you to develop that language, communication, gives you a really good, I think, solid grounding and a space to start, as opposed to, a very stressful, busy hospital setting where candidates can feel very overwhelmed. So bit of an overview on our types of settings. Sometimes we have candidates go into private surgical hospitals as well, sometimes into places that might be like a private cath lab. That's quite rare. Sometimes we do primary health care, for example, like a GP or general practice type clinic. So we have quite a variety, but predominantly aged care, and it's a good place for candidates to start. If you did your placement in an aged care facility and you got a job there and you worked there for 12 months, that does not stop you from going and working again in an ICU department once you've gained the communication skills. People think that, but if I work in aged care, I won't be able to work in an ICU or ED or something like that. Actually, you're seen as more valuable if you've done some work in an aged care environment for at least 6 to 12 months, because you have gained the communication skills, you've gained the empathy towards your patients, you've communicated a lot with doctors, family members, your patients. So you've developed that autonomous practice as well. And it goes a long way when then you transition into more of an acute setting in New Zealand. Candidates often tell us that they want to only go into a set area. Sometimes we can take your preferences and we can give you a placement in your preferred location, but it's not always possible. And at the moment, because of the high demand on all healthcare providers in New Zealand for, we're always competing with undergraduate student nurses of New Zealand. And so if you are a specialist, student nurses always come first, unfortunately, in the Te Whatu order of the DHBs, and overseas nurses come second. So every candidate gets a clinical placement, and no one has missed out on a clinical placement yet because it's part of our CAT course. Sometimes we get close to the line around getting that secured for you, but everything works smoothly once you arrive in New Zealand. As I said, can be anywhere in New Zealand, but we work very closely with job seekers to make sure that that's in an appropriate environment for you, and we work together with them. Before you book your flight tickets to New Zealand, you need to let us know that you've got your visa, and once again we'll negotiate and work with you around when a good time is for you to arrive and when we can secure your placement and get you set up ready to go. It's an opportunity for you to demonstrate you're a competent practitioner. It's only 4 weeks. Sometimes a candidate may need to have a slight extension on their placement because it may not be going very well for you, or sometimes candidates can struggle a little bit with coming to New Zealand the cultural shock that sometimes occurs, and sometimes it's around that communication and working in a very fast-paced environment. So sometimes my tutors, they work very hard to support you in your clinical placement, but sometimes we just need to adjust your practice or work with you to make some slight changes. And so sometimes it might be a 5-week placement or 6-week, depending on what you need. But overall, generally, it's a 4-week placement. We had a recent, sometimes candidates can finish earlier, but we say 4 weeks. That 4th week is like the icing on the cake. It's the week where you're leading shifts, you're working as an autonomous practitioner, you are acting as if you're actually a valued member of the team, and you're really just grounding your knowledge and understanding of working here before you fly on to your next role or your employment or job in New Zealand. Some good to know things. A lot of the issues that candidates have is not really around their clinical knowledge and skills, it's around the English communication. So if you are, if there has been some things highlighted to you around your communication, your tutor will work with you around what you can do to fix that or change that. Where that can go wrong is if you as the candidate don't change your practice to meet our expectations. So it's important that you also meet us in the middle. So we give you feedback. Don't take the feedback as negative. Feedback in New Zealand is actually really important. And we're giving it to you because we want you to adjust your practice. We want you to be successful. As I said in my introduction video, we run a success model at Lonsdale. We don't focus on your failures. What we're doing is trying to course correct or slightly make some adjustments so that you can work safely and competently here in New Zealand. Time management is really important. Turning up to placement on time. Figuring out how you plan your shift. Working around, medication administration, doctor's rounds, starting to follow what other nurses do around schedule. So sometimes candidates say, oh, she's very slow, we're struggling, it takes an hour and a half to do the drug round in the morning, things like that. So it's balancing and trying to adjust your practice to meet the expectations. New Zealand is very cold. At the moment, we're moving into winter. Tomorrow, 1st of June, it is winter officially. And so it does get cold, and sometimes candidates can get sick, which means you may need to take a day or two off work, and you just need to liaise and work in the right process around if you were sick. Aged care specifically is very careful around candidates, coughs, colds, things. COVID is still around here in New Zealand. We have flu season, winter. So a lot of candidates, we encourage you to get your flu vaccine as soon as you get in New Zealand. If you can't access it before you leave your country, you can walk into any of our pharmacies in New Zealand and get a flu vaccination. It's, up to you, but it's highly recommended, especially at this time of year. We have what we call a no blame policy in New Zealand. So sometimes candidates have made a mistake during their placement, and there's been situations where a candidate might have tried to hide it because that's your normal culture. You don't want to say that you've made a mistake. And so you try and hide it. No, it wasn't me. Actually, that's seen as more of a negative if you are found out. So it's important to understand that if you make a mistake, you actually own it, and that you work through a proper process. If you acknowledge your problem and your mistake, you're seen as the bigger person and a better person. You're able to reflect on your practice, then there should be no problem as long as you can actually acknowledge it, work through it, and your patient is safe. and you've done everything that you need to do to make it better. So you're not gonna, if you make it like a medication error in your clinical placement and you've done everything right to make sure that the patient is okay, that you've done you followed all the policies and procedures, then we might ask you to do a self-reflection on the situation, because we want to know that, you know, why did that happen? And what are you going to do to ensure it doesn't happen again? But it doesn't mean it's the end of your CAP course. So it's important that you communicate if you've made a mistake or there's something that's happened, that you talk to your tutor. That's what they're there for as well. Or you talk to your preceptor or the manager at this facility, or charge nurse of the ward. When we're speaking to patients in New Zealand, I call them like language softeners. So, you know, please and thank you, could you, would you mind? It can get quite confusing, I think, sometimes for Indian nurses, but we're not very direct with what we say. We don't say, give me your arm, you know, say, could you please roll up your sleeve? I'm going to take your blood. I'm going to put the tourniquet on. So we're constantly communicating with our patients. We use softeners. It's really important that we're very kind to our patients. They otherwise they can get a bit angry with you if you're not very nice in your language to them. They won't like it if you say, do this. All right. So it's just a sort of a New Zealand thing. And ask questions. It's really important to ask questions. I think some cultures, if you ask questions or you seem to be asking a lot of questions, they're like, does she know what she's doing? And it might be deemed as, you know, you're not a good nurse. Actually, we think the opposite here. If you don't ask questions, we're wondering what's the matter. All right. So it's important that you engage in conversation, you ask lots of questions, and the preceptors and the staff want to help you. And so when you're quiet and you're not saying anything, we're wondering if you're understanding and if there's a problem around your comprehension and things like that. So we need you to do the opposite. Ask questions, engage in conversations, and, you know, be a team player, and work really hard in your clinical placement, and you'll be fine. I've just got a couple of other videos which will be helpful for you. It's not just me talking about what it's like in clinical placement, but it's some candidates talking a little bit about their experience, and then a couple of my senior tutors that work with you in clinical placement.
Hi, my name is Ned Tubak, and I am one of the senior CAP tutor at Lonsdale Education Centre.
Hi, I'm Anne Turnbull.
Hi, Sat Shri Akal. My name is Saman. Hi, Sat Shri Akal. My name is Samandeep.
എൻ്റെ പേര് ടീന. ഞാൻ കേരളത്തിൽ നിന്നാണ് വരുന്നത്. എൻ്റെ പേര് നീതു. ഞാൻ കേരളത്തിൽ നിന്നാണ് വരുന്നത്.
I did research in New Zealand about New Zealand, and I found it really a safe place to work, and it was beautiful.
For me, this is the third week, but still I feel like I'm here for a long time.
I like it here because it's quiet and it's good to raise a kid in here with a good cultural environment.
My experience back home is mostly intensive care unit. I worked 4 years as an RN back home.
When I first came to New Zealand, I thought I will be RN straight away, because I didn't know that I need to go through a process. So I was quite surprised when I have to work as a caregiver. So I did my CAP course from Lonsdale.
Everyone has that fear before moving to any other country.
In my opinion, New Zealand is a very beautiful country, and it's a very peaceful country, and the people in this New Zealand, they are very, their attitude It's a very positive attitude. When we are treating with the patients, it's really different from India. So we have to learn it from the first week. But it's okay because everybody is here. As I told you, my preceptors, co-workers, everyone is welcoming and they are helping to each other. So while we have facing any lot of problems, they are really good to help us.
The healthcare system in back home in India and New Zealand, it's totally different. In India, we don't have much retirement homes. We have the hospitals only.
But we are learning a lot through this process of this 1 month placement course, how to take care of Maori patients and non-Maori patients. I think it's a learning period. We can learn a lot with this 1 month. Yes, of course, there are a lot of challenges. First is the communication, because when I came here, I have to face, the slang of English, it was really not comfortable for me. But after 2-3 days, we will familiar with the slang, and with the continuous talking and everything, we will become familiar with that. And we can understand what they are telling, and what we can understand their comfort level, and we can provide the care as well.
Pain in the ass.
One time while I was working as a caregiver, they told me to collect, they said, I think something regarding the wee. Did they wee? Did they pee? So it was quite a new word for me. I think even I was afraid to ask. I thought maybe they will think I don't know anything. So I have to Google it. Then I came to know that it's a urine.
When we visit our friend or someone calls you to their home and they'll say like, bring your plate or something. Here actually what they really mean is you have to take any dish or any food to their house and go. Yeah. I never did that, but they were saying like someone has done.
Yeah, we have the fresh food in India, so it's fresh in the farms. We're just getting it from the farms. Over here, everything is frozen, and we don't have much vegetarian options. Even from the takeaways, it's very hard to get the vegetarian meal. So most of the time, we have to cook home. I think they need to start eating a little bit meat or egg. Definitely, they can't survive without egg. For me, I was fully vegetarian back home, but now I have started eating egg. Yeah.
Here a lot of things are like frozen one. So even the vegetables, veggies are frozen.
We do have heaps of Indian shops. So they sell the Indian groceries, Indian masalas and everything, and the sweets. If somebody coming from India, they don't need to worry about anything. For the food, we can get it easily. Everything we can get it.
In the aged care setting, it's more about the holistic approach.
In here, we treat them as a family, the resident. It's not just about giving medication nor doing the dressing. You have to look them as a whole, as an individual, and respect them whatever their choices are.
It was really a new experience because here there are a lot of cultures and everything. Here one Maori patient is here, so we have to familiar with their cultures and their wish, and according to them only we have to serve them.
Not just the Maori, but the different culture, because we all came from different background.
Back home, we have doctors 24 hours on site, so they can just give us the orders and we have to follow them. But in New Zealand, we are the one, we have to make a decision. So I believe nurses have a more responsibility in New Zealand.
So maybe just be yourselves and have some eagerness and initiative to learn, because we're here to help them, to be just one like of us.
All peoples, all the team members are here. They are very supportive. If we have any problems or any discomforts, they are very supportive. And in the first week, I'm a little bit discomfort because it's my first experience in this type of home age care centers and all. So, but after my first week, I feel so comfortable here. It's very nice experience.
Advice will be like, I think most of the nurses, whoever are moving from India or wherever they are coming to a new country, they will be having a lot of fear of coming here. So I want to say, like, there is nothing to be scared of, because once you come in here, people are really welcoming and will mend in easily.
So those who are planning to come here, really you can come with confidence.
One more video and then we've got some question and answer time.
Hi, my name is Ned Tubak and I am one of the senior CAP tutor at Lonsdale Education Centre.
Hi, I'm Anne Turnbull. I'm a New Zealand registered nurse and I work for Lonsdale Education Centre.
For candidates coming from overseas, I'm expecting them to really participate and cooperate.
I think that they have to remember that they are registered nurses already and that they have a huge amount of knowledge, and to just be able to apply that to a different setting. Don't be afraid to ask questions. Be yourself. Try and communicate, start speaking and asking questions and talking to your residents and your patients, and don't hold back if you're not familiar with something. The preceptors are there to help. You're there to learn as much as you can in the short time that you're there.
I always encourage New Zealand nurses to use the S-bar method. So it's always nice to introduce yourself to the doctor. Doctors in New Zealand are very lovely. New Zealand is a cold country and they should bring jackets and raincoats, because sometimes it rains. I understand that English might not be the first language, but in terms of communication, it is better to ask questions if they do not understand anything or if they have problems with comprehension.
It's really good to have conversations with people if you can in English, and to have group conversations so that you are not concentrating on just one-word answers. The more you can talk, the better it will be, yeah.
There we have it. So that's a little presentation from me. I hope we've got some questions. I don't see many in the question box, but it would be nice if you wanted to actually ask a question and turn on your camera and speak.
Actually, before we start the question and answer sessions, actually everyone is on mute. We'll unmute everyone, and one person at a time. If everyone start talking at the same time, then it's really hard for us to hear. And if we'll unmute everyone now, and you guys can ask the questions, and one person at a time, please.
Don't feel shy to ask questions. This is your opportunity to ask as many questions as you want.
There you go, you're unmute. And turn the cameras on if you could, so we can see your faces as well. Yes, Mida, you got a question? If you don't have a question, you can mute yourself.
Hi, sir. Hello.
Hi.
Sir, I have done BSc Nursing in India, and I have 4 years of experience in clinical settings. So, and can I apply for the CAP course, and what's the requirement?
Oh, Kim, I'll answer. So, so you need to please contact us after this session, because you need to go through a certificate verification, IELTS requirement, and nursing council process before you apply for a CAP course. It's a long process, but if you contact us straight after this meeting, we'll give you the full information. If you can ask any questions around the CAP course and stuff, it will be great.
All right, sir. So, can I contact you via email?
Yes, after this session, we'll share the contact details. I'll share the contact details on the chat now.
All right, sir.
Thank you for asking the question.
Hey. Anyone else got any question?
പറഞ്ഞോ ചെയ്യാൻ പറ്റുന്ന പറഞ്ഞോ
Smita,
Yes,
got a
sir.
question?
Sir, I have a doubt about one thing.
Yeah.
Whether general nursing and midwifery candidates can attend this course or not? This is a three diploma.
Kim, can you?
Yeah, so you have a diploma, is that correct?
Yes, I have a diploma in general nursing and midwifery. After that, I have I am having a course at specialty nursing for cardiothoracic. So
Right.
I have a 2 qualification, whether I can apply it for this course or not.
Yeah, so you can apply, but you need to still, so either with a diploma or a bachelor's degree, you need to apply through the same process as a registered nurse. So as a nurse, and Nursing Council looks at your past experience, your current experience. They look at your transcripts and they make the decision whether your qualifications and experience is adequate enough to meet the standard of a registered nurse, or if you are going to do, you can do an enrolled nurse cap. So you can be an enrolled nurse in New Zealand or a registered nurse. Slight different scope of practice. However, you're still working as a nurse in New Zealand with, you know, slight different scope, that's all. So absolutely you can apply and go through the process. Nursing Council will make a decision as to what pathway you need to go down, but we offer both options.
Okay, madam.
ready? വിളിച്ചാ പാപ്പാ ചോറൊക്കെ എടുത്തോണ്ട് ചെടിയാണെങ്കിൽ വന്നേ
Hey, yeah, we muted that person.
Yeah, I have a question regarding clinical placement.
Hi, yes.
Yeah, see, I heard like nowadays for after completing the part 1, it is taking too much long to get the clinical placement, the part 2 session. So is it true, or it's like you will make
No, it all
like for the
depends
DHP?
it all depends on your how long it takes you to get your visa, and then once you have your visa, we work with yourself and job seekers or wherever you go, you know, whoever you come through, we work with you to make sure that you get your clinical placement when you want, you know, within a reasonable time frame. Obviously you can't just turn up to New Zealand without us having notice. We've still got a plan and we've still got to prepare, but you know, give us a couple of weeks of your arrival date, we'll have a placement for you.
Once you get your visa, then we will talk to you. We will work it out with you, and we will try and find a placement as early as we can. And all the CAP students who does CAP course will go through a placement process.
Yeah, nowadays, like some of my friends told, it's taking them so much time to get the placement. That's why I just want to clear it. That's why
If you could ring us after this, we can go through and explain what we do and how we do it.
Is it taking them a long time with us or just other people?
I heard it's for the Lonsdale, like after completing the part 1, maybe they are taking too much time to get the placement for, especially for DHP, I think.
Oh, I wouldn't actually expect that you'd get, it's a guarantee that you'd get a DHB placement. I think you need to be open-minded as to where your placement will be, and just understand that it's you know, any placement will not stop you getting the job you want once you complete your CAP. we're just checking that you're safe and competent to practice, accredited by Nursing Council. So I think anyone just needs to be open-minded about where their placement will be. And if you're open-minded about that, then your placement can happen pretty quickly. But if you're specific around where you want to go, you've got no, no budge or movement, then we do sometimes have a bit of a problem with that because, like I'll just give you an example quickly because other people I'm sure want to know this as well. July, for example, we cannot put any candidates into, say, Te Whatu Ora Waikato, which is Hamilton, because they have 180 transition to practice, which is their last clinical placement before they become a registered nurse in New Zealand, that they have to put into clinical placement. So that's priority over a CAP. So, we just have to make sure that we're all working together in New Zealand, but you'll get a placement no matter what.
And I would say from my nursing experience, your CAP placement will help you to get nursing registration. Once you get the nursing registration, to find a job, it's purely based on your previous experience and how you perform in the interview.
Hello.
Hi, Samya.
Hi, sir. I'm already done my CGFNS processing and waiting for the DL. So may I know how long it will take to get DL? Is it someone telling it only for 20 working days? And actually I'm not relay with my agency because I think they are delaying my process, so that's why I'm asking.
If you think they are delaying your process, again, talk to us after this session. We can get some information and we'll try and help you out. If you think you think you're not fair, if you think you're not fairly treated.
Okay, so how long it will take if it's only 20 working days or 40 days? Someone telling 40 days and 45 days.
If you're applying for a DL or any CGFNS process, you should get all the emails directly to your own personal email.
Okay.
I hope you have. If that's not happening, then give us a call after this. We'll chat about it. Because again, whoever is attending and whoever is applying through different agencies, all the agencies, they are there to help you. We are there to help you, but we should be doing this process using your own email address, and you should be getting direct communication from the CGFNS or the Nursing Council, direct updates. And at any stage, if you want to contact CGFNS or Nursing Council, you should be able to contact them through email or phone call as a follow-up. No one should be stopping you from that.
Yes, but in the agency, they are not providing the email and the details. They are telling once it's completed, they will inform me. That's why I'm waiting for the DL. Could you please tell me, sir, when is the intake in this Lonsdale? Next intake?
We don't do intakes. We haven't done intakes for a long time. Once a candidate has been accepted onto our CAP and received an offer letter, they start their CAP straight away. But have a conversation with Jedson's team after the Zoom meeting to talk about your situation, because it's quite different to perhaps someone who hasn't actually started the CGFNS process, and it might be a little bit complicated.
Okay, thank you, ma'am.
Soumya, definitely we can help you with that, assist in a good way. So please get in touch with us after the meeting. We'll sort you out.
Okay, thank you.
Anyone else?
Maybe I will ask a question for the participants, Kim. You might have heard this question a lot of times. Someone was asking me whether I should come alone for this clinical placement or should I bring my family as well. We recommend the former, but I would like to
absolutely. So I think since COVID and since candidates had to come through like MIQ, managed isolation, it was easy for you to bring your family all in one go. It creates quite a lot of complications and challenges for a lot of candidates when they come with their family. It's 4 weeks of your full 100% attention, and I highly recommend that you come independently to do that. It kind of allows you just to really focus on it. It can be a challenge, it can be hard. You're very tired because you're not only doing the workload during your clinical placement that we set for you, you're also adapting to a new culture, adapting to a new climate, and adapting to the way we speak and our English and communication and things like that. So, you know, it's easier for you and to come independently, focus on your CAP course, and then of course bring your family. We want your family here, you know, but it's just, yeah, a period in which we would highly recommend you come independently.
Thank you, Kim.
The other question I wanted to, I hope I covered it in the actual presentation, but I just want to reiterate it again. A lot of people say, oh, why is Lonsdale's course only 4 weeks? Our course isn't 4 weeks. You've got to take into consideration the online learning that you do prior and the revision that you do that exam. So that should take, we expect you to do that within 4 weeks. It's not going to take you 4 weeks, but, you know, it should take you more than a day or two, you know, so we expect that most candidates will get through that if they're working as well full-time while they're doing their studies, 2 weeks. And then you do your 4-week clinical placement when you arrive in New Zealand. So we aren't a 4-week course, just want to clarify that. We are actually longer.
Yeah, that was one of my questions. That was a good one. Thank you for completing that.
No worries. No other questions. Wow.
Looks like it was a good presentation.
Hi, ma'am. Hi.
Hi. How are you?
Hi.
Nice to see you.
Good,
Thank you for turning your video on.
Myself, John Cena. Thank you for the information. So I have started my part 1. So I have few questions, like I have finished the first chapter. So there are like some MCQ questions coming. So if we miss, like we can try it again.
Yeah, absolutely. So are you talking about the questions that are in the actual modules?
In between comes, yeah.
Yeah. So that's fine. Yeah. That's just more to like think about what's been talked about prior. You can do that multiple times. Absolutely. It's at the end. It's pretty obvious when you get to the end that you're doing the actual test or MCQ. Yeah.
So we have to complete each parts, and I have gone through some like some guidelines and PDF. So we have to really go through all these things.
I really recommend it. It's really important so you get a really good overview of what's expected of a nurse in New Zealand, because you really are coming here to work here as a nurse in New Zealand. So if you can absorb as much information as you can, but you know, you're not going to take it all on board straight at your first time. And that's why you have access to part 1 and part 2 for the entire time that you're on your CAP pathway. And then when you finish and you graduate, we'll turn them off. So it's like you can go back and refresh your knowledge, and we recommend, especially just before you land in New Zealand, go back and have another review around the cultural competency, so the Te Tiriti o Waitangi, Māori models of health, code of conduct, professional boundaries, that kind of thing. Go back and review that before you come to New Zealand.
Okay. So once I finish the part full, last I will be getting the certificate. So that's the part 1 completes.
Yep. And then we send you an email and we offer you part 2 and you purchase that. And that's where we work together more around when you're planning on arriving. We send a support letter to help with your visa. And then once you get that visa, we get you into placement.
Okay, thank you. Thank you for that.
John Cena is one of our candidates.
I see. I hear. Yeah.
Yeah.
You
I'm
sound
just
like
keeping with this,
Muslim.
and I'm already going through this.
Ah, fantastic. That's awesome. Can I ask what your specialty is? Like what's your normal practice? Where do you work?
I didn't get you.
What specialty are you working in as a nurse?
I was working in cardiac department and medical.
Perfect. Okay, cool. Well, I look forward to you coming to New Zealand.
Thank you.
You've got very good English. Well done.
Hi, hello.
Hi.
Good afternoon. This is Juvie.
Hi, Juvie.
Yeah. Actually, I was not able to listen thoroughly with the webinar because I have duty, but I tried to, catch up everything. By the way, I'm from Philippines. Do you accept Filipinos?
Absolutely. We love all people. So you're more than welcome to come. We often have Filipinos on our CAP course. Since 2020, when the government made some decisions to make it a little bit harder, we haven't had as many, but we still have had a steady stream, and we have a really good process around supporting you out of the Philippines. So what you normally do is you come in on I'm not sure I'm speaking on behalf of, but most of the Filipinos come in on a visitor visa. And then what we do is we go to the Philippine embassy on your behalf, and we get a special guarantee letter done. And we DHL courier that to you personally in the Philippines, and you take that to the airport when you leave Philippines. And we haven't had any problem with candidates being disembarked off flights and things like that for a long, long time.
Well, that's great to know.
Yeah.
Well, in my case, I am a registered nurse since 2010, and I am confused if I am qualified for taking CAP.
Oh, so you've been a registered nurse. Have you got a bachelor's degree or a diploma?
Yeah, I am a bachelor's degree, and I am a Philippine registered nurse. And then I'm just doubted regarding to my experience.
Absolutely. So what's your specialty do you work in?
I am more on a company nurse.
Yeah. So is it more like older people at home, or is it like district nursing?
In an industrial company, and in airport facility, actually, airline company.
Yep. Absolutely. You should have no problem getting going through the process and coming on a CAP course. What I would say is, if there's areas that you haven't become, it's been a while since you've done like certain assessments and things, then it's up to you to upskill yourself. So maybe it's been a while since you've done like a full head-to-toe assessment on somebody, things like that. It's just refreshing your knowledge, but that's not going to stop you from being a good nurse in New Zealand. So totally, you should come.
Yeah, that's great to know.
And
actually, yeah,
go for it. It's fine.
Thank you. Yeah, that's how to apply for a CAP. So this was written on the. So I see it. We can contact you through WhatsApp.
Yes. Yeah, please, because there is before CAP, you need to do certificate verification and also need to pass the IELTS or OET exam. We'll explain the process if you could contact us.
Okay. Thank you so much. Thank you so much.
No,
have a great day.
Thank you for your questions.
Yeah, thank you. Have a great day.
You too.
Anyone else?
Nice
Great.
to have some brave people to ask questions. I love it. It's nice that you feel confident to ask a question, and it's all part of the process of coming to work in New Zealand.
Great. Thanks everyone for attending this session, and thank you so much, Kim. And yeah, if you have any questions, more questions, feel free to contact us, and we'll share our Facebook and Instagram page details as well. So feel free to contact us and we are more than happy to help and give you the right information. And doesn't mean that we know everything. If we don't know something, there are people we can approach, like Kim's. We always go to Kim if there's a tricky situation, and Kim helps us to tackle those situations at times as well. So yep, we are there to help, and we can definitely work together and help you guys to gain New Zealand registration. Yep.
Thanks, everyone.
Thank you. Thanks for your time.
Bye.
Yo, bye-bye.